Overclassification occurs when non-regulated medical waste is disposed of as though it was regulated medical waste. Waste overclassification is one of the most common violations cited by OSHA, and an estimated 98% of healthcare facilities will receive such citations. The image here shows an example of overclassification because used gloves are not regulated medical waste. Why would it matter if you threw a pair of gloves into a biohazard bag? Overclassification such as this is important for many reasons. Overclassification increases waste disposal costs, which increase the cost of healthcare services for patients and taxpayers. Regulated medical waste is often destroyed through incineration, like in the image here. Plastics, such as IV bags, tubing, and gloves, are commonly overclassified. Incineration of large amounts of plastics such as these items increases the risk of releasing carcinogens into the atmosphere as waste products. In addition, regulated medical waste requires designated transportation, like that shown in the image at right. A large volume of waste labeled as regulated requires more transport vehicles, which increases the risk of costly and dangerous spills and accidents. Your workplace pays more for removal of regulated versus non-regulated waste. Removal of non-regulated waste costs around 1 cent per pound, while regulated waste removal costs between 28 cents and $4 per pound. Let's look at a real-life example of the impact of waste segregation. Why is overclassification of medical waste an important issue? Select all correct answers. 1. It increases waste disposal costs, which increase costs for patients and taxpayers. 2. It increases the risk of releasing carcinogens into the atmosphere. 3. It increases the chances of dangerous spills and accidents. 4. It eliminates the need of separating waste. An inspection of a healthcare facility in West Virginia in 1996 discovered that multiple departments were overclassifying 90 to 95% of their waste. Management said staff were too busy to separate trash. In that year, this facility generated 245,060 pounds of regulated medical waste at a cost of 29 cents per pound for a total expense of over $71,000. The graph at right shows that this facility reduced their regulated medical waste to around 60,000 pounds by 2001 and a cost of $17,400. This is a savings of $54,000 per year simply by segregating their waste. In this lesson, you learned the difference between regulated and non-regulated medical waste, as well as collection and disposal procedures for each type. Remember that each state sets its own policies for regulated medical waste, so be sure to talk with your supervisor for important details. You also learned about the importance of segregating regulated from non-regulated medical waste. Talk with your workplace about setting up waste segregation stations, like the one in the image here, to make it simple for busy employees to keep waste streams segregated.